Welcome to Aging Gracefully on Suncoast FYI. I'm your host, Nancy O'Neill. Each week I speak with local professionals on a wide range of topics, from fitness to finances and from dance to dentistry. We are here to give you tips and advice on how you can live a happy and healthier life no matter what age you may be. Dr. Adam Still with Smile Sarasota is back with us today, and we're talking about CAD CAM Dentistry. So that's a new one for me. Well, at least the term is. I don't know. Maybe I've had it done and I just don't know it. What is CAD CAM Dentistry?
Well, CAD CAM stands for Computer-Aided Design and Computer-Aided Manufacturing. It is by no means a technology exclusive to dentistry. It's used in a lot of different industries, but for the most common dental application, we are able to take a tooth that we just prepared, like say for a crown, for example, and we take three-dimensional images of that tooth. From those three-dimensional images, we can go to a computer monitor and we can actually design the restoration on the computer. And from the design that we do on the computer, it will then get milled out of a solid block of ceramic material, and that's a restoration that can actually just be placed directly in the tooth at that point.
Really?
Yeah.
So it's like a 3D printer?
It's similar to that concept. It's three-dimensional imaging, just like you would with a printer, except instead of actually printing it from nothing into something, we're actually taking it from a block and we're actually milling it down to something that we want to use.
Okay.
But a very similar concept.
All right. Now, what are the advantages of this over dentistry from previous years?
Well, there are actually quite a few advantages. One, because this is a system all done within the office, we can actually do it in one day and in one appointment. So you could kind of walk in with an issue and leave with a permanent restoration in there. Okay. So that's one of the great advantages of it. Other than that, another thing I like about it is that we tend to see less sensitivity with these restorations, because when we prepare the tooth and we temporize it, for example, we leave it kind of exposed to the oral environment for a while before it's sealed again. With this kind of instrument, within a few hours, we're sealing that up again. Okay. And then another big advantage that patients really seem to love is the fact that we don't have to take impressions anymore with these. So we don't have to have the big mouthful of the goop, that people find so annoying. Yep. We're actually using a camera instead to get that same effect.
Okay, I like that.
Yeah.
Yep. Nobody likes to go back to the dentist. No offense personally.
Right, exactly.
What are the disadvantages, if any?
Well, early on with this technology, you had to really want to be a CAD CAM dentist. And when I say early on, this has been around for over 30 years at this point. Yeah. In the early stages, it was very time consuming. The software left a lot to be desired, and it took a long time to get through the process. And then when you're finally done, the final fit and precision of the seal of the restoration was in question. But over the many years they've been doing this, in all the advances in the software and in the cameras that we use nowadays, we really eliminated those issues. If there really was a drawback, it may just be the time involved. Because we have the whole process to do from start to finish in a few hours, I mean, we really have to once we're done preparing the tooth, we're not just temporizing it and send it off to the lab. We actually have to mill the restoration out, then we try it in, and then it goes into the oven where the material goes through its final hardening process, and then we put it in the mouth. So, there's 10 minutes here, maybe 25 minutes there, where the patient's kind of hanging out, reading a magazine or playing on their iPhone.
Now, how long have you been working with this particular technology?
I've been using this for about the last 5 years at this point, and it's even come a long way in that time. Every maybe 5 years that goes by, you're updating the cameras, updating the software constantly. So it's improving every day.
So your office is state of the art. I mean, everything that you do in there is now current with what's going on in the industry. So if somebody wants to get something done, you have it.
We feel like it is, yes, exactly.
Okay. Now, what's your favorite thing about this technology?
Well, it's kind of just fun to use. I sometimes I liken it to, you're almost like you're playing with Photoshop or something like that as you're designing this restoration. Yeah. So it's really enjoyable to use, but because you're designing it yourself, the thing I like about it is the controls in my hands. I get to say how I want the bite to look and how I want the contacts between the teeth to look. So I have the ultimate control of how the outcome of the final restoration is. And there's a number of things that I do enjoy about it. One of them being the convenience of it for the patient standpoint, but also from my standpoint. If I have a patient where they come in and they say, hey, I just broke my tooth and I'm about to head off to Europe for the next 2 months, we don't have to wait for the lab to come and or take the restoration from there. We can actually go ahead and take care of it right there on the spot. They can leave. I don't have to worry about them in a temporary during that period of time.
And swallowing it.
Exactly,
possibly.
exactly,
Yes. Yeah. Well, you sound like you love what you do, which is so important.
Absolutely.
For anybody, but especially in your profession. What do you see the future being now that you said you've seen growth already in 5 years in the technology? Where do you see this going, Doctor?
Well, you, for example, had mentioned 3D printing before. I think that the combination of CAD CAM and then, the three-dimensional type of printing kind of thing that we're doing, that's sort of the future, I think. What we talk about in dentistry is the same as a lot of other industries, where we're watching a shift from analog to digital. In this particular application, we are taking a three-dimensional image instead of an impression. But I think with this digital information we're using these days, this is information that can be quickly transferred from one person to the next. I can email this to a lab or to a specialist that I'm working with on a case, and we can actually, more efficiently transfer the information. And it's probably a way that we can almost more accurately describe this, because we can both be looking at the same thing on the same computer at the same time.
Yeah.
And the way we plan cases out, I think we'll see that all change, and I think that's going to be to the benefit of the patient.
Great. Well, thank you again. Always a pleasure seeing you.
Thank you.
Don't go away. We have more tips on keeping a healthy lifestyle with Dr. Jenny Wilkins from Age Vital Pharmacy. Coming right up.